All right, good morning, everyone. My name is Alan Rippin. I'm the Center for Active Living Director at Athens Community Council on Aging, and I'm really thrilled to have some medical students from the Augusta University and UGA Medical Partnership here to talk about all things vaccinations. You know, the rollout is well underway, and I know people have concerns and questions and what do we do next, and lots of things to cover today. So I want to welcome Anna and Tatiana, Dr. Chappell and Rob. I'm going to hand it over to you all, and thanks so much for being here for this. I know it's going to be a very informative talk, so thank you.
Thank you for having us this morning.
Our pleasure.
All right. I'm going to share our slides here. All right, so like Rob said, we are medical students. We are first-year medical students at the Athens campus of the Medical College of Georgia. And we have just a few slides on vaccination. Each of us have a couple of things to say, and then at the end, we have opportunities for any questions. So in order to understand how the COVID-19 vaccinations work, we first need to understand how our immune systems work. And we kind of talk about them colloquially, and there are some larger words for them, but I think the best way to think about it would be that when you are infected with something like the COVID-19 virus, you have two different response systems. And the way that I like to think about them are your innate response system are kind of like your first responders, so the EMTs. And so when you are initially infected, you've got your EMTs, your paramedics coming to the scene and starting to fight off the virus. But what they also do is call in what we call the adaptive immune system. And I think about that like our special forces, like our FBI of our immune system. And so not only are the paramedics on the scene working right away, they're calling in the FBI, and the FBI, their job is to pretty much take a picture of what the COVID-19 virus looks like, and we call that antibodies. I'm sure everyone has heard about getting an antibody test to see if you've been infected with the virus. It's kind of like just a screenshot of what the virus looks like. And so then our bodies have this picture, so if we ever are infected with the COVID-19 virus again, they know what to do, they know how to respond. And so that is really important for understanding how vaccines work, because we can pretty much vaccinate ourselves so that we are already giving that picture to our special forces, to our immune system, without ever having to be sick. And so there's a couple different ways that we have figured out how to do this with our vaccines. We do have 3 that are approved for use in the United States. And the first 2, the ones that are available through the Department of Public Health, are what we call mRNA vaccines. And so how this works is essentially we are injecting a piece of mRNA, which is just a really big fancy word for like a message. And that is telling our bodies to make a certain protein that are that picture that I was talking about, that our FBI would be able to recognize and then ramp up our immune systems and respond to that infection. And so the Pfizer and the Moderna vaccines are this mRNA that's just pretty much cueing our bodies to make this protein so that we can have that response. The other kind of vaccines that are either being used or are still not yet approved in the United States but have been developed and have been through clinical trials are what we call protein subunit vaccines and vector vaccines. And so the Johnson & Johnson vaccine, that's the 3rd one that has been approved in the United States, is what we call a vector vaccine. And that's using another virus that has been made safe. It's not an active virus. And instead of inserting that mRNA, that message to cue proteins, cue our body to make those proteins, instead we're just putting another virus in. But they do essentially the same thing. It's pretty much telling our cells to then again make these proteins and prepare our immune systems for if we are ever to come in contact with the COVID-19 virus. So next question would be, is the vaccination safe, the COVID-19 vaccination? And the answer is yes. We have vaccinated over 109 million people in the United States as of March 15th. So I'm sure there have been many more since even that day. Prior to their FDA approval and their use in the general public, they were evaluated in rigorous clinical trials. We had tens of thousands of participants, and because of those really promising results, the FDA then said, hey, we do approve these for use. And to date, there have been no deaths linked to the COVID-19 vaccinations. I know that there's a lot in the media right now, and it can be kind of hard to understand sometimes what's going on, but as of right now, we have no deaths linked to vaccination. And you hear about people having adverse reactions, and those are called anaphylaxis or allergic reactions, and those are super rare. They happen to 2 to 5 per million people who are vaccinated, and usually within the first 30 minutes, which you do after vaccination have an observation period. And if you've experienced any kind of allergic reaction to a vaccination in the past, your medical team does check on that for you. And so those are super rare. We have no deaths linked. However, we do want you to talk to your physician if you have concerns prior to vaccination. But we do recommend, and the CDC recommends, that you are vaccinated as soon as you are eligible. And so that leads to our next question: how well do these vaccines work? And so current data shows that all 3 of the COVID vaccines that I've talked about, they prevent COVID-19 infection in most people. I'm sure you've heard the number 95, both Pfizer and Moderna, the 2 that are available right now through the Department of Public Health, have what we call a 95% efficacy rate. And that just means that in 95% of people, they do not have infection. And then in the people who are that last 5%, they do not have serious illness due to the COVID-19 virus. But we do know that all 3 of our current vaccines are effective against common variants of the virus. I know we've all heard a lot about mutations and different variants, especially in other countries, but right now all 3 of our vaccines have been shown to be effective against those, and we have more data coming out about that every day. And we do know that the CDC is actively working with a bunch of research partners across the country to continue to conduct research about how effective these vaccines are, if you can infect anyone after you have been vaccinated, whether you have symptoms or don't, how well we transmit it after vaccination, and just rates of severe disease after vaccination.
All right, so there are 3 main brands of the COVID vaccine that are currently available in the United States. The most recent is the Johnson & Johnson. It just got approved by the FDA recently. Some important things to note about each. So the Pfizer and the Moderna brand are both 2 separate shots. So you're going to have to go in 2 separate times to get that the vaccine. And for the Pfizer, you're going to have to wait 3 weeks or 21 days between the 2 doses. And then for Moderna, you're going to have to wait 1 month or 4 weeks. For the Johnson & Johnson, again, that's just 1 shot. So you're going to go in and it's kind of a like one and done situation. And for the Johnson & Johnson, it's actually a viral vector, like Anna was talking about a minute ago. So it's a little bit different than the mRNA vaccine that Pfizer and Moderna have. So Moderna and Pfizer are both currently being offered by the Clark County Health Department. So that's likely what you will receive if you are to get vaccinated here in the county. And it's important to know that all 3 of these are approved by the FDA, so they are safe. So there's no need to worry about that.
Okay, so why should you get vaccinated? I have a lot of things listed here on the slide, but the first and most important point is that even though Anna and Rob have mentioned a lot of information that we have about COVID and the COVID vaccine, COVID is still a really new thing. The longest set of information that we have spans only a little bit over 1 year. So it's really hard for us to know, A, what the long-term ramifications are, and B, kind of what we can expect in terms of treatment, preventing long-term disease, disability, things like that. So the first reason that you should get it is because we want to prevent serious illness now, and we want to prevent any serious illness or disability in the future. Like they said, we have these vaccines that are highly effective. And so, you know, it's the number one thing that you can do to keep yourself safe now and keep yourself safe moving forward, especially like Anna mentioned with these variants and a lot of the unknowns that we still have and probably will continue to have for a while. The second reason is that you can avoid a lot of COVID-related things, including being in the hospital, including, of course, illness, including having to quarantine the way that we've come to know over the past year, and even having to get tested. Regulations that the CDC has put out for people that have been fully vaccinated are actually really, really great. And we'll talk about those here in just a minute. But of course, the benefit of getting vaccinated is for the general population, we can help slow the spread of COVID, and hopefully in the not too distant future, with appropriate vaccination, we can all get to life that's a little bit more as we knew it pre-COVID, and the vaccine is going to help get us there. In terms of your family, friends, all of the people that we have all gone without seeing for the better part of the past year, the new CDC guidelines for people that have been fully vaccinated say that if you are in a room with other people that have also been fully vaccinated, you can gather indoors, you don't have to wear masks. It will just be a much better time and a much happier party. So get vaccinated, encourage your friends that are eligible to also get vaccinated, because you know, it requires a team effort to get to that point. If you are going to a household, let's say visit a family member and they are not vaccinated, as long as you are fully vaccinated and you're going to the one household, you know, they all live together, you are fully okay to be with them, even without wearing a mask, if you've been fully vaccinated. The CDC says that's safe, it's not a problem. And if you don't live in a group home environment or around a lot of other people, if you were to be exposed to somebody that is known to have COVID, you don't need to quarantine the way that we've been doing, and you don't need to get tested. So I know a lot of trouble, heartache, and lack of comfort comes along with being quarantined and being tested, and those can be things of relative past if you get this vaccine. And then the last thing that I've included here is travel. A lot of countries or tourist areas are opening up to travelers that have gotten their vaccines. So if you are like me and you love to travel, getting fully vaccinated is the way to get you there once again. So currently in Georgia, and this is as of the past couple of weeks, of course, this is an ever-changing situation. If you are watching this online and it is after March 18th, it may be that these guidelines have changed. But as of today, March 18th, we know that any healthcare worker, first responder, law enforcement, firefighter, EMT can get vaccinated. Residents and staff at long-term care facilities, teachers and school staff, and then individuals over the age of 55, which is teachers, individuals over 55, and kind of the tail end of this list have been the more recent addition. Additionally, if you are inquiring about family or friends, anyone over the age of 16 with disabilities or certain medical conditions that I've listed here may be eligible for the vaccine. Now, some of these have a little more guidelines in terms of the severity of the disease before they make you eligible. So, of course, check with the health department website for the most current information. But as you can see, it's a pretty inclusive list. So you or someone that you know may be eligible if you have one of these conditions. Parents of kids with complex medical conditions are also welcome to get the vaccine, as well as caregivers. And then if you are asking yourself the most important question that hopefully has been burning on your head since we started this presentation, which is, how can I get vaccinated? I've included a couple of things here. The Department of Public Health is doing amazing things in Athens and really everywhere. So I've included the link here, and I will make sure that I've shared that link with the appropriate people so that hopefully we can get it posted along with this presentation. That sends you directly to the registration page. They post new appointments on Tuesdays at 3 p.m. You do need an active email address, but once you've signed up, they'll kind of take it from there, give you all the information that you need. And I've also included the number for the Department of Public Health. If you don't have an active email address or you're having any difficulty with any of this arrangement online, you can call that 888 number, and they will be more than happy to help you in getting an appointment scheduled. You can also go to vaccinefinder.org, and that will open it up to, I think, a bigger market of vaccine administration, though what the specifics will be after that, I don't have as much information about, but definitely the Department of Public Health will be very, very useful in getting you vaccinated.
So what should you expect when you go into your vaccination appointment? So you're going to go into your appointment, and when you arrive, you're just going to go through a checklist with one of the healthcare personnel there, and they're going to kind of make sure that you're okay to get the vaccine that day. And there's a couple different things they just need to check on, for example, like if you're on like blood thinners, may need to consult with the doctor on that, but that doesn't mean you're not going to be able to get the vaccine that day if you check no or yes for any of the things. So it's important to keep that in mind, that just because you say yes to something, you're not going to not be able to get it. But that's just to make sure that everything's going to be safe for you to get it that day. So then you're going to go ahead and get the vaccine. It's a pretty quick and painless process for the most part, like any other shot. And after you do that, some of your information is going to get written down on a card. And it's really important to hold on to this like vaccination card. It's going to have the day you got your shot, the brand you received, and then the day you need to go into your second appointment. And so you're going to want to bring that with you to your second appointment if you're getting the Moderna or Pfizer vaccine and you have to go in a second time. And they're also going to give you a list of some facts and some general information about the specific vaccine you received, maybe to clear up any other questions you have. And if you have any other questions, there's links to various resources that you can go look at online. And also, it's really important to keep social distancing and like wearing your mask and following all those guidelines while you're at your appointment as well. Next slide, please. So after the vaccine, you're going to need to wait about 15 minutes at the clinic just to make sure there's really no allergic reactions you may have. In the very rare event that does occur, it'll probably be within that 15-minute window. That's just an extra safety precaution we take. So if you have an allergic reaction, you're going to also be monitored for 30 minutes instead of 15, just to any previous like vaccination or medication. And there will be room for you to sit as well while you're waiting. So that will be kind of like set aside for you. So you may have some side effects after the vaccination. You may feel sore in that arm. It may kind of become red, it may swell a little bit. But this is all part of the normal protection process that's being built up to the virus. It's your body's immune system jumping in and working. That's just a sign of that. You also may have achiness. You may feel fatigued. May even get a fever. That's also a part of just the normal immune system process that's working. And it's important to note that you may feel a little worse after the second dose if you're getting that second dose for the Moderna or Pfizer. So just keep that in mind. So a couple different myths or facts that seem to be pretty commonly asked. So can the COVID-19 vaccine make you sick? So the answer is no. It cannot make you sick with COVID-19 because you're not actually getting a part of like the live actual virus in the vaccine. So after getting the COVID vaccine, will I test positive for a COVID-19 viral test? The answer is no, because this will not give you an active infection. It'll just work to build your protection to COVID and not actually give you COVID. So you will not test positive on a test. If you have already had COVID and recovered, do you still need to get the vaccine? The answer is yes, because it still will build that immunity to COVID that really kind of up your immune system response and your body's response to the virus if you get exposed again. So will the vaccine protect me from getting sick with COVID-19? The answer is yes. It is going to ramp up your body's response if it comes across the virus. And then will the vaccine alter your DNA? The answer is no to that. Again, it's just changing your body's response and not actually changing your DNA. Your body will just react differently when the immune cells come across any viral particles. And then will COVID affect your ability to have a baby one day? The answer is no to that as well. It is a safe thing if you plan on becoming pregnant in the future. And that is all we have for you.
That was really fantastic. Oh, sorry, go ahead.
I was going to say just a few things I want to add in that questions that come up commonly is which vaccine is better to get. So if you had a choice, which one of these should you get? There's not one that's better or worse or more safe or less safe. You should get whatever one is available to you the soonest. So whether that be the Moderna or Pfizer or the Johnson & Johnson, we recommend whatever you can get, you get, okay? And then I also recommend you take a picture of your vaccine card after you're vaccinated, because if you're like me, little pieces of paper go missing very quickly. So it's good just to have record of that so that in the future, if we need it for travel or anything else, you have record of it in your phone or your computer. And then I want to say the biggest reason I would say for your population to get vaccinated is be able to see your grandkids and your family. My mother-in-law was fully vaccinated as of last week, and she got to hug my children for the first time on Monday, and that was amazing. And she stayed with us this week to help me while our nanny is out of town. And for me, that has been the most amazing part of vaccination, is getting to have that moment after a whole year of not getting to give her grandkids hugs. So I think that's the number one reason right there, is to get back to a little bit of normalcy, like Tatiana mentioned. So
that's so well said. My parents got vaccinated recently, and it's completely changed their outlook, and they just can move around their life with more freedom and give hugs. And I've seen it just transform kind of mindset and outlook on things, in an instant. So it is a great reason, just so we can be together again. I had a list of questions, but you've answered all of them. Thank you. That was very well presented, very thorough. I have just a question about research. Who's conducting the research on the studies to tell us, what we need to know? Where does that come from? And what will it take for us to get to that next place where we don't have to worry about wearing masks or not? And how long do you think we will be wearing masks? Just kind of thinking ahead a little bit too. What kind of research do we need to have in order to move that forward?
I can take that one. I did a little bit of reading about it when talking about, is this safe? Is this effective? And in terms of who is conducting the research, there are a lot of people conducting research. If you think about it, there's a lot of health institutions that want their workers to be safe, and so they have the power. There's a whole list on the CDC website of like hospital systems, especially academic medical centers, who not only are worried about their workers, but also want their patients to be safe. And so they are the ones primarily conducting the research of, okay, what does transmission look like afterwards? in terms of, do we think that someone who has been vaccinated can be an asymptomatic carrier?
Right.
And I think I have heard preliminarily that that is something, especially with these CDC guidelines changing, that the answer is, we think you can not be worried about asymptomatic transmission. However, like I said, research is still ongoing, but the CDC guidelines changing is something that's really exciting and promising for people to be able to gather with other people who are vaccinated, kind of like Dr. Chappell was talking about with her family. And so I think lots of the research is coming from those large health academic institutions, but there also are a lot of smaller ones, or even at like the national level, the National Institutes of Health. There is a giant list. It is linked on the bottom of the slide. So if you are interested, you could see who is conducting what, but a lot of the questions surround, can we gather outside afterwards? I do know that the CDC still recommends that you social distance and wear a mask, especially in public places. And so I know, for example, our medical school class, all 50 of us were able to get vaccinated. And so we met yesterday for the first time in person to have class in our first year of medical school. But we still wore masks, we still distanced, and we do that. We plan to do that continually. And that is just for out of the safety and precaution of all the other people in the building and each other, just because there is still research ongoing.
That's great. Yeah, that answers my question of sort of, are we a carrier if we still are vaccinated? That's really encouraging to think that we wouldn't be. So that's fingers crossed that stays. And I know there are a lot of people on the case doing great research. So thank you for kind of putting that in one place for us. One question I've gotten from some clients is questions about boosters. I know we're just trying to get this phase done and get the first one, but that's already kind of, I know a lot of people that are like, I don't care, I'll get the booster, it's fine. But where are we on that?
You want me to take that one? So again, ongoing research. The researchers are monitoring how long your antibodies last. So if you see this virus, how long are you going to continue to have this bigger, robust response? There are trials going on now with the people that originally got the vaccine in the clinical trials before it became approved, that are now getting booster doses that just started to kind of see about that.
Okay.
It is very possible that this is going to be like the flu vaccine that you need to get on a yearly basis. So we are just going to have to see, especially if we start having variants that mutate and they're no longer responsive to the vaccine, then we may need to get boosters that are going to cover those variants. So time will tell, but I think that that's a distinct possibility that we'll need to get boosters in the future, which is very common for vaccinations. Your grandkids and friends that have little children, you may know that they have to get several shots, the same shot over and over, and that's exactly why it's just boosting that immune response. So.
Okay, that's good to know. And I do take it all with a grain of salt in the sense of, we just don't know, things are always changing and being updated, but it's all very hopeful for the future. So I don't have any other questions, but I know others may in the future. What should someone do if they've watched this video and may have additional questions? Who should they reach out to?
I can give you my contact information for them to reach out to me, or I always recommend going to the CDC website. They have a wealth of information about the vaccine, about the virus, and it's constantly being updated because as everyone's mentioned on this call, it's an ever-changing situation. We're learning more and more every day. And so I think that that's a great resource. I caution you against Googling COVID on, it's just like anything, anybody can put anything on the internet. So it's really important to go to reliable sources like the CDC, or there's other vaccine websites that you can look at that have nice, reliable information for you.
Okay, great. And any last thoughts for anyone who's still on the fence?
To kind of follow up to what Dr. Chappell just said, before this about the variants and in terms of how boosters and whatnot. I did watch something the other day that I hadn't really thought about yet, but we do know that our 3 vaccinations do cover all the current variants. But Dr. Fauci said, I've heard from him a lot over the past year. He was like, the more people we have vaccinated, the less people there are for there to be variants. And so if anyone's on the fence, it's kind of like well, we're all in this together, and hopefully we wouldn't need boosters for other variants if we were able to vaccinate quickly and effectively in a lot of us. And so I think that we're all in this together, and then being able to hug your grandkids really are the top 2 reasons in my book for being able to for taking a vaccine.
Mm-hmm. Thank you for that. That's such an excellent point. The faster we can stop this, the less we have to think about the iterations of it. Yeah, well said. Thank you guys so much for your time and expertise on this and sharing this knowledge with our clients and our community. Thanks for all the good work you're doing in school and in the community. Come back and visit us and share the latest with us, and when you're ready for an update. Definitely. Lovely. Yeah. So yeah, if anyone watching needs to reach out to myself or someone on our staff, we're happy to do that and connect you with the right people. So but great. Yeah, thank you again so much for being here.
All right, thank you for having us.
Thank you so much for having us.
Our pleasure. Thanks. Bye.